The Skinstructures tip of the week. Ever struggled to explain to your client why their skin might flare up seemingly out of nowhere? Well, I've got a fantastic analogy for you next time you try to explain this. The bucket theory. Imagine your client's skin as a bucket. Each rosacea trigger, things like sun exposure, spicy food, stress, and even certain skincare, is like a drop of water going into that bucket. Some drops are small, others are big splashes. Explain to your clients that while one small trigger might not cause a problem, when several drops accumulate and the bucket gets full, it overflows, leading to a flare up. This helps them understand that it's often a combination of factors, not just one single thing, causing their skin to react. By visualizing their triggers as filling a bucket, clients can better understand the cumulative nature of rosacea and feel more empowered to identify and manage their individual drops to keep their bucket from overflowing. It's a simple yet effective way to explain the often complex world of rosacea triggers. Give the bucket theory a try with your clients this week and let us know how it goes.
Welcome back to the Skinstructures, the podcast where we bring you all things aesthetics. I'm your host, Morgan.
And I'm your host, Jolie. We're so glad you're tuning in with us today. Before we start, I want to thank one of our amazing listeners for their review. They wrote, "This is such a good listen for anyone who is into self-care and or business. The two hosts have such good chemistry and share the best info on the latest in the wellness industry. Thank you so much for taking the time to write this. I'd have to agree, we really do have good chemistry."
Agreed. We kind of love each other. This week, we're focusing on a skin condition that many of us will encounter in our treatment rooms, rosacea. April is Rosacea Awareness Month, making it a perfect time to dive into understanding and managing this common concern.
That's right, Morgan. Would you agree that there's a lot of misunderstanding regarding rosacea?
Totally. We often think of rosacea skin as delicate little flowers, but in some cases, we can be a bit more aggressive with treatment.
I agree. Rosacea is a very common skin condition. As highlighted by the National Rosacea Society, about 16 million people are affected by it. It's characterized by blushing or flushing and the appearance of visible blood vessels on the face. Often it can be mistaken for acne because it can also present with small pus-filled bumps.
While the exact cause of rosacea remains unknown and there isn't currently a cure, it's important for us to understand that it is manageable with the right products, treatments, and by being aware of individual symptoms and triggers.
Absolutely. Dr. Abaji offers an interesting perspective, classifying rosacea as a subtype of acne, a disorder affecting the pileosebaceous units. He notes that unlike acne, where sebaceous glands might be large or overactive, in rosacea, these glands tend to enlarge gradually as we age. Ultimately, we can't prevent or cure it, but we can certainly help to treat and control its manifestations.
Dr. Abaji has a different take on rosacea than most, but I think it's important to know and consider when treating it. But more on him later. So rosacea presents in several subtypes, each with distinct characteristics. We have erythematotelangiectatic rosacea, which is marked by facial flushing and visible blood vessels, often appearing as persistent redness in the central face with easy flushing.
Then there's papulopustular rosacea, characterized by redness along with bumps or papules and pimples or pustules. This type can easily be confused with acne, but typically lacks blackheads or whiteheads and is accompanied by redness and visible blood vessels.
We also see phimosis rosacea, which involves a thickening of the skin, most commonly on the nose, known as rhinophyma. Identification includes enlarged pores, a thickened skin texture, and a bulbous nose, and it's more prevalent in men.
And lastly, there's ocular rosacea, which affects the eyes, causing redness, dryness, irritation, and eyelid inflammation. Clients might report red, watery eyes, a burning or gritty sensation, and sometimes blurred vision.
On that note, let's dive a bit deeper into the predisposition for rosacea. While it can affect anyone, it's more commonly observed in individuals with fairer skin tones, particularly those who may have a history of easy flushing or blushing.
Yeah, that's right. So often we see a higher incidence in individuals of Celtic or Scandinavian ancestry. While it can occur in anyone, including those with darker Fitzpatrick skin types, it's statistically more frequently diagnosed in those with lighter complexions. Since redness is a key symptom of this disorder, it's more easily identified in lighter skin tones. In darker skin, the redness can be masked by melanin, making it harder to detect and potentially leading to underdiagnosis or misdiagnosis, says the National Rosacea Society. It's also worth noting that rosacea tends to emerge more in adulthood, typically after the age of 30, and in those who have a history of acne in adolescence. It's more common in women than in men, although men can often experience more severe symptoms and are more likely to progress to advanced stages like rhinophyma. Furthermore, there does appear to be a genetic component. So, if there's a family history of rosacea, the likelihood of developing it may be increased.
Absolutely. Piggybacking off of what you said about rosacea and skin of color, according to the Skin of Color Society, specific clues can indicate rosacea in individuals with skin of color. These include a warm or a tight feeling on the skin, a red or purple discoloration, acne like breakouts that don't respond to typical acne treatments, itching, burning, or stinging when applying products, or itchy, irritated eyes. It's important to be aware of these less commonly discussed presentations.
Absolutely. So let's talk about what can trigger rosacea flare ups. It's going to feel like pretty much everything can trigger it. While the exact cause is unknown, several factors can worsen symptoms. These include sun exposure, wind or cold temperatures, hot weather, alcohol consumption, spicy foods, hot beverages, stress, and even an overabundance of Demodex mites or vascular abnormalities.
Demodex mites. Let's elaborate on that a bit. They creep me out. Almost everyone has these tiny Demodex mites living in the hair follicles of the face. If you have never looked this up, just don't.
Don't.
It'll give you nightmares. But it's a very common occurrence. For most people, these mites cause no trouble at all. However, if the immune system is weakened or if certain skin conditions are present, like rosacea, these little mites can multiply rapidly, leading to an itchy, irritating condition called demodicosis. These mites are particularly prevalent on the cheeks, eyelashes, forehead, outside of your ear canals, ew, and the sides of your nose. It's worth noting that dermatologists may prescribe ingredients like ivermectin, which has anti-inflammatory properties and targets the Demodex mites.
I know it's nothing to worry about, but thinking about that makes me
It's
itch.
disgusting.
So, speaking of beneficial ingredients, there are several that can really help manage rosacea manifestations. Niacinamide or vitamin B3 is a versatile ingredient known to reduce inflammation, redness, and improve the skin's barrier function.
Absolutely. Azelaic acid is another powerhouse, recognized for its anti inflammatory and antimicrobial properties, which can help reduce redness and those bothersome bumps. And for hydration without irritation, hyaluronic acid is key and it's a potent humectant.
And don't forget about ceramides. These lipids are essential for a healthy skin barrier, and using products containing them can help protect the skin from external irritants and potentially reduce flare ups. Antioxidants like green tea extract, vitamin C, and vitamin E are also valuable for combating free radical damage and reducing inflammation.
Licorice root extract contains compounds that can calm the skin and reduce redness, and chamomile is well known for its natural anti inflammatory benefits, helping to soothe irritated skin.
Aloe vera is a fantastic option for gentle calming and hydration. Zinc oxide, commonly found in mineral sunscreens, if you listened to our last episode, can also help calm inflammation and redness.
Building upon these beneficial ingredients, I want to discuss Dr. Abaji's approach again. If you haven't read his book, The Art of Skin Health, Jolie and I both recommend it to any skin professional wanting to learn more about different disorders and conditions. His approach to rosacea is often implemented through his Zeo Skin Health medical product line. His philosophy goes beyond just addressing surface symptoms. It aims to normalize skin functions to better manage rosacea.
Yeah, I agree, Morgan. We can't sit here and talk about rosacea without mentioning Dr. Abaji. We've both had the privilege of hearing Dr. Abaji himself or his daughter Serene speak at different ZO seminars, thanks to Boscal. Dr. Abaji's approach really focuses on normalizing overall skin function to manage rosacea more effectively. It's not just about calming the immediate symptoms.
Absolutely. A key aspect is aggressively reducing visible redness and inflammation. Dr. Obaji's Zeo Skin Health line has a product called Rosatrol, and it's phenomenal. So it's central to this, utilizing ingredients like lactose and broccoli extract, as well as their exclusive Zeo RRS2 complex with plant stem cells for their soothing and antioxidant properties. Rosadrol targets the 5 symptoms of rosacea: inflammation, decreased cellular turnover, excess sebum, telangiectasia, and neuroaging. The focus on controlling excess oil, which is not always talked about when dealing with rosacea, is a lead contributor to the inflammation.
Yeah, he describes it as being essentially allergic to your own oil. Although we can't do this as estheticians, I do think it's interesting to know that he often prescribes a very low dose of isotretinoin for his rosacea patients to treat the sebaceous gland enlargement and hyperactivity to reduce sebum activity.
Exactly. He also stresses the importance of improving skin tolerance to restore strong skin barrier function, using ingredients to restore hydration and improve the skin's natural defenses, like their Z polycomplex. And of course, antioxidant protection is vital. Also, while it might seem counterintuitive for sensitive skin, they often incorporate gentle exfoliation to improve skin texture without causing further irritation, often using enzymatic exfoliants.
Yeah. A few other ingredients he recommends are benzoyl peroxide because of its antibacterial properties that can reduce rosacea related inflammation, retinoids to help combat skin inflammation and accelerate cell turnover, and then AHAs for epidermal exfoliation and renewal. It's definitely an approach that many dermatologists and skincare professionals consider. So Morgan, shifting gears a bit, what happens when a client comes to us experience a full-blown flare-up? What should our immediate response be?
If a client presents with a rosacea flare up, they might show increased and more intense redness, potentially with new or worsening bumps and pustules. Their skin might feel more sensitive, hot, or tight. In these situations, it's best to recommend they see a dermatologist for guidance. And during a flare up, we should avoid any exfoliation or aggressive treatments in the treatment room to prevent further irritation. Our focus should be on gentle, soothing care and recommending they follow their dermatologist's advice. Metronidazole, an antibiotic with antimicrobial and anti inflammatory benefits, can help with calming a flare up, and clients should see their dermatologist for that.
Yeah, I completely agree. In terms of professional treatments, facials focusing on reducing redness and hydration, maybe a cooling and calming masks, these can all help provide relief. Hydrofacial can be a beneficial option for some, particularly those with papulopustular rosacea. Certain chemical peels, such as VI Peels Original, are an excellent option. And then additionally, vascular lasers and IPL or BBL therapy can effectively reduce redness and visible blood vessels.
As estheticians, we play a vital role in guiding our clients' home care. We should emphasize the use of mild, fragrance free cleansers and gentle, hydrating moisturizers. Recommending products with calming ingredients like niacinamide, aloe vera, green tea extract is also important. Sun protection is a non negotiable. So, we need to stress the daily use of a broad spectrum mineral sunscreen with zinc oxide or titanium dioxide. Finally, helping clients identify and avoid their personal triggers is key to managing their rosacea effectively.
Yeah, encourage clients to use a rosacea diary to help them track their triggers and see what could be causing their flare ups. The National Rosacea Society has an excellent one available to download on their website. We should also educate our clients about rosacea, its triggers, and the importance of gentle skincare, setting realistic expectations that it's a chronic condition that we aim to manage, not cure. Encouraging regular follow up care with both us and their dermatologist is also essential.
So, just to recap what we've discussed today, we've covered what rosacea is, how common it is, the different subtypes it can present in, predisposition factors, including considerations for skin of color, common triggers, what to do during a flare up, how we can approach treatments for different skin types, beneficial ingredients, and essential home care advice we can offer our clients, including insights into comprehensive approaches like Dr. Rabaji's.
That brings us to the end of our episode on rosacea. We hope this information has been helpful for all of you on your aesthetics journey.
Thanks for tuning in to the Skinstructures podcast. We'll see you next time. Don't forget to subscribe, rate, and review. And as always, don't hesitate to educate.